Pneumonia in 5 questions. Symptoms, ways of transmission, methods of protection. There is an extraordinary increase in pneumonia cases around the world. Pneumonia, medically known as pneumonia, simply means inflammation of the lung tissue. Various viruses and bacteria can cause pneumonia. A patient with this disease feels discomfort, pain in the chest, breathing and breathing difficulties. The disease can cause a more severe condition as the oxygen level in the blood decreases. In November 2023, health authorities in China reported an increase in some diseases, including influenza, COVID, and bacterial disorders. According to Chinese media, there has also been an increase in cases of pneumonia affecting children. The World Health Organization, WHO, noted that no unusual microbe or cause of the disease was detected as a result of the examination of the cases. The winter months we are in are the first winter in China after strict COVID restrictions. It is considered that the immunity of the population may have decreased during COVID measures. WHO also evaluates that immunity deficiency may occur, especially in children, during the COVID restrictions period. Significant increases in flu and similar diseases were observed in countries such as England, France, Denmark, and the USA after the pandemic bans were lifted. It is known that epidemic diseases cause serious congestion in hospitals in Turkey. As a result of the spread of these diseases and pathogens, the incidence of pneumonia cases is increasing. According to WHO data, pneumonia is the leading cause of child death worldwide. In 2019, 14% of deaths in children under 5 years old were caused by pneumonia. According to data, more than 740,000 children died as a result of pneumonia in 2019. What is pneumonia? According to the Turkish Thoracic Society, pneumonia, medically known as pneumonia, is inflammation of the lung tissue. It develops due to various microbes, especially bacteria, viruses, and fungi. Pneumonia can occur in anyone, but the disease poses a greater danger for some people. Young children, the elderly, and people with chronic health problems may be more vulnerable to pneumonia. For example, people with heart diseases, diabetes and lung problems, people with low immune systems, and some cancer patients. What are the symptoms of pneumonia? Symptoms of pneumonia include a high fever, chills, phlegm, shortness of breath, and weakness. While symptoms may appear suddenly, it is also stated that in some cases the disease may follow a more insidious course. Weakness, loss of appetite, and shortness of breath that last for a few days may also be caused by pneumonia. Symptoms of pneumonia in children may vary depending on the child's age and the factor causing pneumonia. The most common symptoms are fever, cough, and rapid breathing. For a definitive diagnosis, you should definitely consult a doctor and health institutions. Early diagnosis and treatment of the disease is critical to prevent more serious and life-threatening complications. How is pneumonia transmitted? Pneumonia can be transmitted in several ways. In children and adults, viruses and some bacteria that enter the body through breathing can reach the lungs and cause disease. Inhalation of droplets spread into the air when sick individuals cough and sneeze, or contact with objects containing these pathogens are the main factors in the spread of diseases. According to the Turkish Thoracic Society, for example, the flu virus itself can cause pneumonia, but it can also facilitate the emergence of other types of pneumonia caused by other microbes as a result of the damage it causes to the respiratory tract. This also applies to respiratory viruses such as COVID and influenza. How is pneumonia treated? If it is possible to treat the infection with antibiotics, physicians may decide on antibiotic treatment for patients. In some patients, this is not necessary. Treatments such as plenty of fluid intake, rest, painkillers, and antipyretics are also used. Some patients may require hospitalization depending on their health condition. Oxygen support may also be needed to facilitate breathing. It usually takes 2 to 4 weeks for patients to recover. Doctors can monitor the patient's condition with the help of lung X-rays and blood tests. How can we protect ourselves from pneumonia? In order to increase the immunity of people who are at high risk of developing pneumonia and severe pneumonia, vaccines may not protect against all types of pneumonia. However, compared to those who are not vaccinated, vaccinated individuals are protected against a more severe course of the disease. Hygiene measures such as frequent hand washing, not smoking, and measures to keep the immune system strong such as exercise and a balanced diet make individuals more resistant to pneumonia. According to the General Directorate of Public Health of the Ministry of Health, in order to prevent pneumonia from spreading in society, one should not go to school or work and rest at home in the first days of the disease, when microorganisms are most spread. To protect the household, hands should be washed frequently and the room should be ventilated. It is also useful for the sick person to wear a mask, especially if there are people nearby who are at risk of a severe course of the disease.